and learn. So I'm going to get started. My name is Lynette Haleo-Stewart, and I am the Director of Early Childhood Initiatives at Niagara University, and we are housed in the Levesque Institute for Civic Engagement. Today, we are bringing to you a wonderful presentation. Wendy Bender, who is the Executive Director of the New York State Association of Infant Mental Health, is going to present to us some things we may not know about early childhood and infant mental health. And we're going to also learn about the infant mental health endorsement. When we talk about infant mental health, we're looking at the span of time between birth and age 5. And Wendy's going to present for us today a lot of valuable information for all of us that we can apply to our own lives, our professional lives, our future professional lives for those of you that are students. So Wendy, we're going to turn it over to you to get started.
Thank you. It's wonderful to be here with you. I would much prefer to be in Niagara County and connecting with you in person, but this Zoom sure offers us a wonderful opportunity in the midst of the physical distancing that we can still make these connections and be part of the work of each other. So I'd like to just ask for folks, I know some of you have already started this, if you would be willing to use the chat box. I'm not going to offer a run through of Zoom. I think by now most people have spent more than enough time on Zoom, but if anybody has any questions, you can unmute yourself and let me know, but otherwise you'll find the chat box. It should be at the bottom of your screen. And if you just click on that, the little chat group will open up. And if I could just invite you to share, you don't have to say who your name is because that shows up, but just share where you're from, what kind of work you do. Just to take a couple moments to make some introductions. What you guys are showing, we have a very small group, and yet what you guys are showing is exactly what this is all about. So if you see from the slide under our name, it says strengthening the knowledge, competencies, and skills of the infant early childhood workforce. We're looking at all of you, okay? So if you see at the bottom, it offers our website. I'm hoping that you're intrigued as we go through this day and you're going to visit our website to just take a peek, and would love to have you follow us on Facebook or Instagram. We do post infant mental health related activities, information daily, okay? My plan is that I'm going to really invite folks to stay muted through most of this. If you've got some questions, if there are questions that you're dying to answer, unmute yourself and ask. But what I'd like to ask is that we keep most of those questions to the end. So we know we've got plenty of time to get to those questions. So if you bump into questions along the way, write them down so you don't forget them, okay? And let me take a minute just to introduce myself. I'm a social worker. I live in the capital region of New York, and I've been a social worker working with young children and families for a career that lasts more than 30 years. I've worked in medical and health settings. I've done a lot of work with early intervention, and I did a lot of work with the home visiting programs across the state. And through that work, I got to visit Niagara County quite often. you guys were one of the places that I got to visit on a regular basis. So I missed that. I haven't been back for a couple of years. But it's nice to be with you today. So if I can have you change the slide, Lynette.
Is this the right one?
Yes. So I just wanted to start out to let you know that we are part of an international group called the Alliance for the Advancement of Infant Mental Health. So if you'll see on this map, this shows the 31 states and Ireland and Western Australia that are all part of this same alliance, all using the same endorsement that I'll talk about in a little bit. The states and country that are listed in blue are those associations that are in the midst of, they call them exploring. So they're in the midst of looking to see, can they bring this endorsement process to their state? And I really like sort of starting out showing you this because this is a movement that is much bigger than what we're doing here in New York State. We're actually, some of these states have been part of this group for 15 years or longer. So we're 20 years or longer. So we're coming into this and really joining with a lot of effort and a lot of force, a lot of this movement that is happening across the world. Next slide.
I don't know why it's taking a minute here. There we go.
And even more, we're part of the World Association for Infant Mental Health. And so there are associations across the world. Okay. And I just think it's really important to recognize what we're part of. Okay. Yep, that's fine. So I want to just ask you a little bit, what do we mean when we talk about infant and early childhood mental health, IECMH? No, not quite yet. Okay. We're looking at the mental health status. It's an interdisciplinary field. And then we're looking at principles and practices. And so what I'd like to ask each of you to do for a moment is, what happens to you when you hear this term of infant mental health or early childhood mental health? Can I invite you to use the chat box and just share what's your first response when you hear something like that? I often get very quizzical, skeptical looks. And I'm wondering if any of you have felt that or heard that or experienced that when you've used the term in your work with other people. Yeah, Marilyn offers caring for children's mental health. My mind jumps to the ACEs, adverse childhood experiences. Yep. Relationships between children and caregivers. I wonder how it's a parent with infants. Perfect. Infants and young children's emotional needs being met. Yep. I had a somewhat recent experience. This was before COVID times when I was out and about with lots of people, but I was at a conference, a statewide conference, and I had a table set up. And this woman walked by, we smiled and exchanged pleasantries, and then she noticed the sign which said infant mental health. And she stopped in her tracks and she looked at the sign. And then she looked back at me and she had this very quizzical look on her face and she repeated it. She said, infant mental health. I didn't know babies could get that. And I love sharing this story because it says two things to me. The first is how quickly, when folks hear the term mental health, that we jump to mental illness. So we skip right over the mental health component of it. And we don't think that when we hear about health in general, physical health. You don't skip right to physical illness. We do that with mental health. And then the second part that really stands out to me is most people don't have a recognition that mental health is a thing, that it's happening for very young children. I can't tell you how many times in my career I've heard a version of something that says, if this horrible thing had to happen for this child, at least it happened when she was young enough that she won't remember it. And I think that's a fairly typical thought. And what it says is that, we don't have, in our earliest of years, we don't have the language that we need for what we typically think of as memory. When we typically think of memory, we're thinking of a narrative, a story, language, verbal. Very young children don't have that yet. But we now know that those memories are being stored. Babies are very sensory experienced, and they're experiencing things through their senses, and the body remembers these experiences. So we're recognizing that with ACEs, with the ACE study, the adverse childhood experiences, and we're also recognizing implicit memory. So those memories from very, very early on that are in us, we don't have language for them, which makes it even harder to understand what they are. Okay, next slide.
For some reason, there's a slight delay as I'm trying to press this. There we go.
Okay, so this is the definition that we use, and this comes from 0 to 3, the Policy Center. If you are not familiar with 0 to 3, I strongly recommend that you take a peek at their website and become familiar with them. So what we're looking at when we talk about a definition is the capacity of a child from birth through age 5 to experience, regulate, and express emotion, form close and secure interpersonal relationships, and explore and learn their environment. All of this is happening within the context of my family, my community, and my culture. So I invite you to take a moment to just think about those 3 things and think about someone you know. Think about, and it could be an adult or a child, but think about their ability to experience, regulate, and express emotion. Their ability to form and sustain close interpersonal relationships. And their ability to explore their environment and learn. The very foundation, like the foundation of a house, the very foundation of these 3 significant areas, our social, emotional, who we are being formed in these earliest years of life. And so what this means is that, like a house, if you have a sturdy, strong foundation, when big storms come along or there's other kind of issues that happen, that house is standing on this firm foundation. So there might be windows that are blown out of a 2nd story, but the foundation stands. And it's the same concept when we're looking at our social emotional well-being. The very foundation for it is built in our earliest of years. It doesn't mean that things may not come along that are going to challenge that as we grow. But the foundation, if it's strong, it's going to help us get through it. Okay? So we're talking about an interdisciplinary field. As all of you offered your introductions, you are demonstrating the different fields that you're from. We are looking to work with everyone who works with or on behalf of infants, very young children, and their family, to work from the perspective of infant mental health principles. We're looking at this wide. So if I can ask you to take a minute using the chat, can I ask you to start listing some of the people that we're talking about here when we're looking at this interdisciplinary field, this multidisciplinary field? Who all is part of this? Use the chat and just offer some of your thoughts. Early childhood agencies, yep. So child care centers, preschools, absolutely. Thanks, Marilyn. Policymakers, absolutely. Parents, grandparents, and other family members, child care centers, educators, doctors, therapists, yes, pediatricians, early intervention, counselors, professors, absolutely. And then we've got the whole court system. So family court, child welfare, nurses, everyone, yeah. Anyone who works with or on behalf of, that's what we're targeting. Okay, next slide.
For some reason, there's a little delay. I'm going to have to try to figure this out before we meet next time in between. I don't know why.
I have my slides up if you want to.
Okay, I'm going to use my mouse. That seems to be working better than my computer. So I'll use the mouse from now on, and I think we'll be good.
Okay, so I want to just talk a little bit about infant and early childhood mental health principles. These are the theoretical foundations and values that guide our understanding about what infants and toddlers and their families need. Okay. So these are relationship-focused interventions with both the very young child and parent on behalf of their relationship. And this is a key starting place for this work. What this is saying is that there are many of us that are working more directly with parents. There are many of us that are working more directly with children. And we need to keep part of our work, part of the lens through which we see what we can do to help. We need to see this parent and child as a dyad. We cannot, I love the little phrase that says, when you think about a child, you think about a baby, you think about a baby and someone. So we need to keep our focus always on both, and the focus being on their relationship. So if you're working directly with young children, how do you make sure that your perspective is always including that parent and how you can help offer something to enhance their relationship? If you're working with a parent, how do you keep that perspective of bringing the baby into the picture and how you can help support that relationship? Okay. So this applies to all of those professions, those areas of work that we talked about. Okay. So I'm just going to run through some of those principles. I'm going to just give you a little overview. 85% of brain development occurs before the age of 3. And development builds. It's like a scaffolding. I'm not going to get into the details of this because I think many of you teach this or you're training on this all of the time. One of the concepts that we talk about so often within infant mental health is this concept of serve and return. So we're looking for those interactions where there is, like a tennis game, a serve and a return. So a response back and forth, time that is allowed to stay here in their interaction. And what we're finding from a lot of studies is that relationships are built with a lot of those serve and return, where the parent and child are seeing each other and this connection is strengthening. Okay. Okay. So foundations in one area, they're all intertwined and build subsequent development. We can no longer think of mental health and development as separate. They're intertwined. Okay. Up to 14% of children in the country aged birth through 5 experience social emotional problems that negatively affect their functioning, development, and school readiness. And this 14% is sort of across the board numbers. When you get into some high risk communities, those percentages are even higher. We know that what happens during pregnancy and the earliest years set the stage for either a sturdy or a fragile existence. Three to 5-year-olds get expelled from preschool and childcare at a higher rate than any other child. And kindergarten teachers identify social emotional skills as their biggest challenge. I always find it amazing when you ask kindergarten teachers what are the most important things that when they think of a child coming to kindergarten ready, they rarely say the biggest things are that they can write their letters and they can do their numbers, and they talk about things like the ability to get along with friends, the ability to interact with adults, the ability to regulate emotion, form those relationships, and explore and learn their environment. And we know that we need to start much earlier. So with the ACE study, and I'm not going to get into the ACE study, I find this just such an exciting thing. If you're not familiar with the ACE study, which stands for Adverse Childhood Experiences, I strongly recommend you look that up, you find a training, you begin to inform yourself. I've been training on ACEs for probably 20 years, and I find it just absolutely fascinating. When I used to ask a group of people, if you've heard of the ACE study, I would get like one hand that would start to raise and then like, oh no, don't call on me. I don't know if I know that much. And now when I ask that question, almost every hand goes up, which says we are really getting this information out there. What we are learning from this is that these early experiences have an impact for life. That's what the ACE study is telling us. We know that children as young as 1 year of age can be diagnosed with post-traumatic stress disorder. So even though they don't have that language that has the memory, they don't have a story, the body is storing that and the body remembers. Okay. So the child gets onto a trajectory toward a poor outcome. When a child gets kicked out of preschool, what do you think is likely to happen by the time they're 17? Once this trajectory starts to happen, trajectory starts to happen, it is hard to get off of that. Okay? What we're learning is that chronic stressful conditions, such as extreme poverty, abuse, severe maternal depression, or other trauma, actually disrupts the architecture of the brain and leads to lifelong difficulties when there is no buffering protection of a nurturing adult. Children who are exposed to early stress develop an exaggerated stress response. So what this means is that our stress response is almost like a thermostat. We're designed to experience stress and turn it up to make ourselves safe. But when any of us is experiencing a lot of stress on a routine basis, that stress response is dialed up. When this happens starting in childhood, what we're learning is that it actually has an effect on the entire person. Premature aging is happening for these young children. Their stress response is dialed up, and they're in this permanent state of churning and hyper-awareness and hypervigilance. Okay? Complex trauma is a term that is often used in this work, where it talks about exposure to multiple traumatic events. So relationships are key. This is that quote that I talked about. There's no such thing as a baby. If you set out to describe a baby, you'll find yourself describing a baby and somewhat. So relationships are at the absolute center of this work. And again, relationships with the child, relationships with the parent, and using your relationship with a focus on their relationship. It's almost as if you want to see, if you've got a child and parent in the same room with you, you want to imagine that there's almost like another person in the room, and that's the relationship between the two of them. And these relationships can be very challenging to understand, because how a child is with mom may be very different than how a child is with dad. And it may be very different when it's mom and dad together. And then there's a sibling, and then there's grandpa. So these relationships are what is forming this foundation for this child. That's what we want to keep in mind. Okay? Okay. Children's development depends on the quality and reliability of their relationships. The best way to support babies is to support their parents and families to build and strengthen nurturing relationships with them. One of the most critical factors in buffering the impact of complex trauma is a positive attachment and a connection to an emotionally supportive, competent caregiver. Okay. So this is a concept that we focus on within an infant mental health world, recognizing that there can be both ghosts and angels in the nursery that will impact the emerging attachment relationship. And what this means is that when I had my child, there I was, my baby and me. Nobody else was in the room at a moment like this that I'm describing. And yet, I am there with all of my experiences, all of the things that built the foundation for me of my social emotional well-being. All of those experiences that I've carried through my lifetime and helped create who I am and how I am. So all of those things were part of my relationship with my baby. All of those things were in the nursery with us. Some of them were the angels. those nurturing, caring, wonderful experiences that helped me feel like I am competent and going to be able to do this job. And some of those were the ghosts, those past experiences and relationships that put me in the place of not feeling really confident and really questioning myself and hearing a cry that made me say, there's something wrong here. I think I need to stop this, as opposed to trying to understand what was happening between us. Okay? So ghosts and angels. And then I just want to talk a little bit, give a nod to this concept of resiliency. It is so important, and it's a critical component anytime we're talking about this infant mental health work, to also bring in looking at what is resiliency. How come some kids get through rough situations and do pretty well, and other kids are really, really sidetracked by it? What is this resilient piece? Okay. And there's a lot of work being done around resiliency. One of the things that there's a lot of talk about is protective factors. Next slide. So this work is really looking, and they've defined it into these 5 areas, that these things serve as protective factors. So even when there are events happening in the home, the community, the culture that are very challenging and very different, very difficult, these factors can really help serve as protectiveness. Okay? So parental resilience, when the parent has that ability to get through it, they manage their stress, they're able to keep functioning even when things are challenging and difficult. Social connections. And this is very different than just the kind of agency support that we might provide, some of the social services. Those can be really important. Those are more the concrete support. But the social connections, these are the kind of, this is friends, these are family, these are somebody that knows me when I go to the grocery store. Those kind of little connections can really, really matter. Knowledge of parenting and child development. If I truly believe that my 7-month-old should be able to sit quietly on the couch while I talk on the phone for 10 minutes, no wonder I'm going to be upset when he doesn't do that. So if I start to understand what is typical for a 7-month-old, then I have some resources to fall back on. Concrete supports, taking care of those basic needs for myself and the family. And then this last one, understanding social emotional competence of children. So understanding that definition and how my role serves a huge part in helping my child build that strong foundation. Okay. Thank you. So Marian Wright Edelman offered this quote: "The issue is not, are we going to pay? It's, are we going to pay now, up front, or are we going to pay a whole lot more later on?" And I think I'm talking to the choir as I say this, but all of us can see how we're paying a whole lot more later on when we haven't offered children what they need when they're young. We have the ability, we have so much knowledge right now. We need the ability to really put all of these practices into place, have the supports that we need, and we have the ability to, that's one of the amazing parts of infant and early childhood mental health. We have the ability to be preemptive, preventive. There's a lot of later problems that we can avoid when we put our energies, our efforts, and our finances early in a child's life. Okay? Because what's going to happen is that if I have adverse childhood experiences, I am still likely to grow up and have children. And without supports and understanding, I'm also very likely to pass those along generationally, because that's how I was raised. Okay? We have the ability to make a change in that. I don't think that I'm being too, I don't think I'm exaggerating to say this is how we can change the world. It really is. Okay. All right, thanks. So I'd like to talk with you just a little bit about the NICE AIM endorsement. So again, New York State Association for Infant Mental Health, NICE AIM. And this is the endorsement for culturally sensitive, relationship-focused practice promoting infant mental health. And again, we are part of 31 states and a couple of countries that are all using this same framework. This is a framework that can be used across disciplines to promote high quality relationship-focused practice. Okay? Across disciplines. We want childcare providers, pediatricians, family court judges, home visitors, early intervention providers, early Head Start, professors, clinicians. We want policymakers. We want everyone who is working with or on behalf of very young children and their families to invite them into this shared framework. Okay? The endorsement is defined by sets of competencies, and those competencies really guide my professional development. So the idea behind this is that I'm looking to see, how do I make sure that I'm meeting each one of these competencies, and how am I meeting this framework? Okay? They provide this foundation for knowledge, skills, and best practices. They invite dialogue for collaborative practice, training, evaluation, and professional growth. How do we work together? Okay. And promotes systems growth and change. Okay. Next. So the way these competencies are divided is, you can see on the left-hand column, there are 8 competency domains. So theoretical foundations, law, regulation, policy, direct service skills, working with others, communicating, systems expertise, thinking, and reflection. So those 8 competency domains are applied across this shared network. So whether you're a child care provider or a family court judge, it's important that you are looking at those areas of competency, because that's what we know very young children and their families need from us. And so the process of working toward, the endorsement is sort of the end point. The competencies are what guide us. So the idea behind this is that each person is building a portfolio. So you're looking at all of your education, you're looking at all of the specialty training that you've had, you're looking at your on-the-job experiences, maybe any leadership roles you've had, and your experience with reflective supervision. And you're applying it, you're looking at those 8 areas and saying, how do I meet each one of these competencies based on all of those things in my career? So for many of us, you come to this process with a long career. I often joke that when I started this process, I had to go back to look at my college transcripts from 1925. It's not quite that long ago, but a while ago. And the process of building my portfolio was recognizing that, holy cow, my freshman year of college in 1925, I took a course on early childhood development. And that's one of the places that I began meeting some of these competencies. And it built, and this training and this experience, all of it formed who I am. So one of the things that happens for most folks as you work through building the portfolio is that you will hit a competency area or two, and you're going to go, oh, you know what? I don't have any specialty training in this. One of the ones I'll point out in the top right box, it says attachment, separation, trauma, and loss. So that's an area that folks may not have had any specialty training in. So the competencies really then serve as a guide for professional development. That's something I'm going to be looking for. I want to find some training. That's an area that I want to make sure I understand a little bit more about. Okay. Okay. So what this slide talks about is that while we use the same set of 8 competency domains for all the early childhood workforce, what we would expect from some folks is different than what we're going to expect of some other folks based on the kind of work they're doing. So because of that, the endorsement is divided into 4 different categories. These categories are not hierarchical, means that 3 is not better than 2. It's that they're different based on the kind of work we do. So the first category talks about infant family associate. These are folks that are focused on promotion. So this can include a lot of the early care and learning community, administration, healthcare, might be a pediatrician, might be case management, maybe a family court judge. And what this says is that in my role as a family court judge, I want to bring infant mental health principles into my view, and I want to promote that in the work that I'm doing. Okay. The second category, the infant family specialist, is focusing on prevention. So these are folks where they're a significant part of what they're working on is they're working with children and families where there's some identified risk, and they're focusing on preventive strategies. So this is early intervention, maybe early Head Start, home visiting, mental health consultation. And then the third category, the infant mental health specialist, these are the folks that are focused on treatment. These are the clinicians. So these are folks that maybe are offering infant, child, parent psychotherapy, interaction guidance, and other infant mental health clinical work. And then the fourth category is the infant mental health mentor. These are the folks that have been in the field for a longer period of time, and a significant part of what they are doing is focused on supporting the rest of the workforce. So this last category is broken into 3 subcategories. There's the infant mental health mentor clinical, so treatment folks, but now this person is more in a leadership role and focused on providing reflective supervision. There is the infant mental health mentor policy. So again, somebody that has been in the field for a long time, focused on policy, whether that's local, regional, statewide, national, international, but they're policy focused. And then the last is the infant mental health mentor research faculty. Again, been in the field for a while, and their focus is on supporting the workforce. Okay. All right, next slide. Why earn endorsement? So, join a growing global community of like-minded professionals. And I want to just stay with this one for a moment. I'm a social worker by trade. I'm proud of being a social worker. And yet, when I am with a group of folks like you, where we're all focused on this early childhood work, this is where I feel my connection. So we're building this community of early childhood like-minded professionals. Okay. The endorsement demonstrates achievement of a specialization. It helps grow the professionalism of the infant and early childhood mental health field. It demonstrates a level of expertise to peers, employers, judges, and the community at large. And it reflects on one's own professional journey and the experiences gained that have led to competency. So we are still relatively new at this here in New York State. We have 40-some people who are endorsed, and we have, I think, like 45 or 46. We have about 130 folks that are in the process of building their portfolio. Like I said, the portfolio building process for some people can take a couple of months. For many people, though, it's a process that will take a year or two, because part of that process is identifying some of those competencies and saying, I need to seek some specialty training in this area in order to, that's what I need. That's part of my own professional growth. Okay. And I just wanted to include my contact information. I hope you're intrigued and interested in learning some more about what we're doing at Nice AIM. One thing I do want to let you know, this is, I haven't been quite able yet to formally announce this, but we have a state grant that in 2021, we will be off, we do a fair amount of training, but we'll be offering free 2-day courses. We call them our Infant and Early Childhood Mental Health Basics course. And we're going to be offering quite a number of them. Again, we're funded through a state grant with this, so it'll be free. We're also, as connected to that offer, we're going to be able to offer some reflective consultation groups for folks who are serving in either supervisory or consultative or manager kind of positions. So if you're interested, stay tuned. Make sure that we'd love to have you join and become a member. At the very least, make sure that you get to our website and sign up as a subscriber so that you're on our mailing list. Stay connected. All right. So we do have a little time for questions, comments. You can stop sharing, Lynette, if you would. Okay. We can see each other's faces. We have such a small group. I'd love to just open it up, unmute yourself and offer your thoughts or questions or.
One thing I'm curious about, Wendy, is if this is new to them. Is this the first time they've heard of the endorsement? Are some of you working with colleagues that already are going through that process? I'm just curious how you learned about it, or if you just learned about it from the advertisement we sent out. I just was curious about that. I know it's still new to many people, even though it's been around for a little while now, Wendy.
A few years.
I am the infant toddler mental health consultant coordinator at the Child Care Resource Network. And I had not heard about it until my supervisor mentioned it to me. You know, she wanted me to do a little bit of homework on it. I know our infant toddler specialists are endorsed, so she wanted me to do some homework on my end. And then I saw this, so I thought, oh, okay, a little less reading and I can spend on this and get the information. So definitely something I'm interested in.
Wonderful. Glad to meet you with that, Sheila. And you mentioned the infant toddler specialist. So we've been working with the Early Care and Learning Council, and they've been supporting some of the infant toddler specialists to go through the endorsement process. So we're doing any individual is absolutely welcome to become part of the process and work toward endorsement, but we're also really strategically wanting to work with organizations. In some of the other states that have had this endorsement going for a long time, they've built in things like for therapists or early intervention providers who are seeking, who have Medicaid reimbursement, they get a higher Medicaid reimbursement rate. So building in that structure, and we're working toward that. It's going to take us a few years to get there, but we're absolutely working toward that. So thank you.
I did have one question as far as working towards it. You know, do we, you know, create an account and then as we get things, we pop them in, or is this something we wait and we build it up and then once we have everything, then we, you know, go for the endorsement?
Great question. The way it works is that hopefully folks, you want to explore a little so you know what you're signing up for. But once you sign up, and depending on the category, the registration fee is either $15 or $25. Okay. The one and only ongoing cost is that you have to maintain membership in your state's association. Okay, so you have to be a member, and then there's a registration fee. Once you've paid that registration fee, you sign up and you get assigned an advisor. So somebody that has the endorsement is going to be available for you to help walk you through the process, help answer questions that you might bump into. We're available as well for that. But so you've got somebody with you. And then you start doing things. You send your transcripts in, you start building, and the way the portfolio is set up, you just can start building. And you're looking to say, so looking back at my transcripts, and here's all of those competencies, where did I meet any of these? So you're doing that with your trainings, with your education, you're doing with any special training that you've taken, and then you're talking about your work experience, how that has led to the competency, okay? And again, you get an advisor to be available to help walk you through the process. We still have a little time. I'd love to hear anybody's thoughts on, and not necessarily just the endorsement, on infant mental health, on how this fits with your work. For those of you that are off camera, I'm not sure if maybe you're eating and don't want to show us your dribbles, but I'd love to see you if you're willing to show yourself, or at least just verbally check in. Hi, Morgan. Good to see you. Hi, everybody. Marilyn, good to see you again.
Same here. I was eating, so that's why I went.
I figured that was it. Who wants to show yourself dribbling as you're on screen, right?
Guilty as charged, yeah.
I just wanted to put a little plug in for Wendy. I recently attended the basic course on infant mental health, and that's kind of what she was talking about. There's going to be some opportunities coming up in the future for some training. And it was very, very informative. It was 2 days, but I feel like I know a lot already. I've been teaching for many years in higher education and involved in advocacy work, but even I felt like I walked away learning something new. And I always try to approach any new experience by something new I can walk away with. I never assume I know everything already, and I thought it was excellent. So if you do have that opportunity to take the basic course for infant first aid, and remember it's birth to age 5, so those that are pre-K teachers, I know Sheila Philly, who's on from Niagara Falls City School District, is a pre-K teacher. It really is relevant to the work that we do, and it fits so nicely with those of you trained in the pyramid model. And Marilyn is one of our Cadre trainers we work with closely at Niagara University in our offerings. And a couple people on our call, Justina has gone through that and the coaching. And so there's so many elements, as Wendy said, it really is multidisciplinary and can fit into many strands of our disciplines collectively to help strengthen our ability and our capacity to respond effectively to children and families' mental health.
And one of the big things is that we need this multidisciplinary workforce, because each of us brings our own specialty to this. And I certainly could not step into the court system and know what I was doing. I'm a social worker. I have some knowledge of some things, but not the whole thing. I need all of those folks to have the competency that they need. I need everybody in early care and learning to have those competencies. I need everybody in the health system, all of us coming together and being able to use and review and support each other. Okay.
Wendy, I just have a question. How soon will you identify the days you're going to do the training in 2021?
We are on the cusp. I was so excited just before I signed on to this. I got a note from my state contact saying, right, you've got these 3 things and then you're ready to go. So any day, as soon as we get the okay from the state, we will be releasing those dates. And we have a very ambitious schedule laid out for 2021. So there will be lots of opportunities, but because we're looking at doing all of them virtual at this point, we're keeping the numbers down. So if you're interested, I would encourage you to sign up as soon as they're listed, because I expect they'll be pretty popular.
Okay. So
if you're not on our mailing list, get on our mailing list. That's the way you'll see things as soon as they're offered.
the fastest.
And that's right through your website,
Yeah,
correct, Wendy? They can sign up for that and they'll get the regular.
So go to the
updates.
website, and then under membership, there should be something about subscribe. Okay.
Okay.
If by any chance you are bumping into any problems, there's another way on there that says contact us. We use the reach us at nysaimh.org.
Thank you.
Yeah. Anything from those of you that haven't offered anything? Was any of this helpful? Does it fit with your work?
You know what? I do have to say what was a little surprise to me was when I think of infant toddler mental health, I don't think of it going to 5 until you said it over and over. That is a nice awareness for me.
Yeah. And yeah, we're really prenatal through age.
Sure.
Yeah.
Sure.
Thanks.
Wendy, I did want to point out in the chat box, I did put the link for the Survey Monkey,
Thank you.
asking everyone to please click onto that. It's a brief survey. We would appreciate if you take the time to complete that. It will give Wendy some feedback. And it will help us as well. So if you have a few moments, you could make sure you do that before you leave. I did put it in there a little while ago in case some people had to scoot out early. So hopefully everybody saw that.
Thanks. Any other thoughts or comments or questions or anything from anybody? Okay. I hope we stay connected. I hope our paths cross in the future.
All right. Well, thank you so much, Wendy, for your time today. And thank you to everyone who attended the session. Hopefully it helped enlighten you a little bit more on infant mental health. That what Marilyn said, I think, is true. When we're thinking about infant mental health, we're not necessarily thinking all the way up to age 5, but that is the span of time that is focused on that infant, those early years of life, as Wendy so eloquently talked about. So thank you so much. It was very informative, and I hope many of you will take advantage of the opportunities in the future offered through the New York State Association of Infant Mental Health that Wendy spoke of, as well as the opportunities we offer at Niagara University through the pyramid model, as well as other professional development we will be offering as we continue to move forward. We do have a virtual panel tomorrow. For those of you that may have seen this advertisement, if you didn't register for that, I encourage you to do so. It's from 3 to 5 tomorrow. And also, if you have any colleagues that did not attend this session, Wendy is going to do a repeat for us tomorrow from 6 to 7. And there's still time to register for that.
In the evening, not in the morning. Tomorrow.
Yes, in the evening, not 6 a.m. That's right. 6 to 7 in the evening. Well, thank you. If anybody has any other questions, Wendy and I can linger on for a little bit longer. And if you need to get back to work because this was your lunch break, thanks for spending lunch with us.
Yes.
Thank you very much.
Yeah. Good to see you,
Have a good
Mary.
rest of the day.
Everybody.
Thank you.
Jill,
Thank
nice
you.
to meet you.
I missed what you said, Marilyn.
Oh, Sheila, I haven't seen Sheila.
Oh.
Graduate
She'll
course.
be at the summit. She'll be at the summit today. She's one of the presenters in one of the breakout sessions.
Awesome. I'm going to review everything you sent. Did you send, Lynette, do you want us to be on a little early or same?
Well, if you can, we're going to log in our team at 2:45, 3. So if you want to, you can. For those of you, you've been a part of our summit, so I think you kind of have a sense of things, but feel free to do so if you want to. We'll admit you in early.
Sure. And Lynette, did you send the link for the meeting today? Or
The link, we sent everything out. I sent it last night around 7:30.
okay, I got
I sent the link. Yeah, I sent the link with the instructions, and then there's a Google Drive with all of the materials.
Okay. Thank you. Nice
All
seeing you.
right, thank you.
Good to
Okay,
see you.
Bye-bye, Marilyn. Wendy, I think it went well, other than I had a couple technology glitches. Now I'm wondering if you feel more comfortable. I think if I just set you up as a co-host, I think you can do it.
Yep.
If I'm not mistaken. So I think we'll do that tomorrow.
Yep. Or even if you click on your share screen on the right-hand side, there's a little arrow.
Yep.
Click on
Multiple
that.
participants can share simultaneously.
Just that, I mean, you can do that one, but the other one, it just the middle section, just make sure that everyone can share.
Okay. Yep.
So as long as that's clicked, then I can share.
That's the one little thing we didn't go over beforehand.
Yes.
So I apologize. I think we covered everything else,
Yeah.
but I still think it ended up going fine. It was fine. And I'm glad if we count ourselves, there was 13 altogether, which was a nice, it was a nice little size group.
Yeah.
We're expecting more at the other one. I'll try to get the exact number, but
That's all right.
I thought that one was up to more like 20,
Mhm.
maybe-ish.
Okay.
So I'll double check, and we still have time to get some more registrations for that one. But overall, I think it went really well, and it was an interesting group.
Knowing the group, is there anything that would be good feedback for me is there anything that might be more particular that I didn't talk about that I could, or?
No, I think that you covered it for this particular group. I'm anticipating the next group might be a little bit more diverse. I'm not sure, but I'm guessing it might be.
Yep.
So, and we're also going to put a little plug in during the summit today. At the end, when we're doing our wrap up, we're actually going to put another plug in for the things we have going on tomorrow, the virtual panel and you. So we'll, you still could get another straggler or two. You never know. We've been trying all different methods. I think some people are just zoomed out. We were just talking about that. We have 97 registered for our summit today. And considering people on Zoom so much, we're thrilled.
I'll say.
We're really excited about that. I don't know how many at the last count we have for the virtual panel. I think it was 30 last time I checked, but that was days ago. So I'm hoping we'll get at least 50 for that, but we'll see. Again, it's always tricky trying to come up with the right soft spot for the time that's going to get the most participants. We knew if we did it earlier in the day, we would be ruling out a lot of teachers and things. So we tried to make it later, but we didn't want to crouch into their personal family time and trying to juggle all that. So we went with the 3 to 5. And now I don't know if you watch NBC News, but 2 days ago, NBC Nightly News on the 16th with Lester Holt, there was a little segment. It was about 3 minutes and 18-second video. And it was on the pandemic and how the isolation is impacting children's development. And they're seeing an uptick in children around the country, ages 3 to 6, that are really struggling. It was really excellent little segment. So I actually have embedded that in the virtual panel, and I'm going to have that be part of the lead-in. They talk about resilience in it, and it was so timely. So I'm actually going to embed that in as sort of part of the kickoff before we get into the panel. It kind of shows just what we're living in right now. And it was perfect. When I saw it the other night, I'm like, this is great. I gotta take this clip and put it in. But I found it very easily on YouTube. And it was under their segment they call America Under Pressure. So it's toward the end of the 6:30 World News. And it was America Under Pressure, Pandemic, Isolation Impacting Young Children's Development. But it was very, very good, very well done. And they talked to a doctor, and they talked to a clinical individual. They talked to a parent. They talked to a child. It was really, it covered everything. And so it was really well done for like a little 3-minute, an 18-second segment.
I'll take
You
a
might
look.
want to check it out. I just wanted to mention it to you. It was,
Thanks.
sign of the times, what we're dealing with here.
Yep.
So.
Okay.
Well, I hope that this inspired some of them to pursue exploring this further, and maybe you'll take advantage of some of the opportunities you're going to have.
Yep. Yeah,
All
wonderful. All right, thank you.
We'll see you tomorrow, and we'll have a little smoother transition with the slides.
Good luck with your other events. Hope they go well.
Thank you. Thank you. Bye-bye now.